Hello everyone. My name is Dr. Rinwan Puiralte and I'm Associate Professor in the Department of Veterinary Microbiology from Khalsa Veterinary and Animal Sciences College. So today we're going to talk my topic on current developments in canine immunotherapy, exploring the latest advancement in canine health. So what do we mean by immunotherapy and why it is important to discuss about canine health, especially in the immunotherapy aspect? There are various challenges when it comes to canine immunotherapy. That is because there's a lot of breed variability. Then there is a cost factors when it comes to drug development by biotech companies, and there is a various heterogeneity of the tumor biology and insufficient analysis of cancer antigens and their immunogenicity and targetability. And we also lack a well-researched and characterized components of canine immune system and their interaction with tumors and their microenvironment. Now, the important thing about canine immunotherapy and their current development is if we know this, then we can have a targeted treatment to revolutionize the health aspect of canine medicine. And we can give a long life, a good quality of life for our pet animals. Now, when we talk about immunotherapy, we should know the definition that immunotherapy means we can use many different types of biologicals which we will introduce inside the body, and then that can lead to immune response, and that is the target of immunotherapy. There are many different types of immunotherapy. Immunotherapy can be done with the help of genetic engineering. If we use genetic engineering, then we call that as gene therapy. And we can also use immunotherapy in combination with the currently available treatment, especially in case of cancers like surgery, chemotherapy, or any other medical treatment. So when we combine this, we call this as a combination targeted therapy. Now, immunotherapy has two main parts, that is passive immunotherapy and active immunotherapy. So passive and active immunotherapy can be applied in many different areas in case of the treatment of allergy, the treatment of cancer, autoimmune disease condition, especially, and also infectious diseases. Now, the use of immunotherapy is important because it is very precise, it is very dynamic, and it also leads to development of memory, which can be later on used by our own immune system. Why is immunotherapy important in dogs then? As we said, it revolutionized canine health medicine, their treatment. Now, when we talk about the immunotherapy, there are many different types of immunotherapy depending on what type of treatment or what type of targeted therapy that we want to achieve. So we have oncolytic virotherapy, we have cancer vaccines, we also have immunomodulators, we also currently has adoptive T cell therapy, immune checkpoint blockade or inhibitor therapy, and the most common one, antibody therapy. Currently, we have approved and licensed immunotherapy medications, or we can say medicines, which are easily available. Some are still in the clinical trials, whereas some are already in use, especially those are under prescription medications, and they can be only used by licensed veterinarians. Now, all these types of immunotherapy that we discussed, the most important one, or I can say the most commonly, which is already in clinical phase, that is adoptive T cell therapy. We have three different types of adoptive T cell therapy. The first one is tumor infiltrating lymphocyte therapy. Then we have engineered T cell receptor therapy, or we call that as TCR therapy. And most recently, we have a CAR T cell therapy, that is a chimeric antigen receptor T cell therapy. So these three T cell therapies are currently in use. Here the tumor or the tumor tissues that is extracted from the animal. That is, in the laboratory, what we do is we take the tissues. Out of the tissues, we generate antigens, and those antigens are reintroduced into the body of the animal as a form of vaccine. Now, after vaccination is done, we waited for immune response to take place, and after immune response is seen in the body of the animal, we again through the form of apheresis, we remove T cell, and T cell is in the laboratory specially treated so that it has a specific target, that of the tumor of our interest, and that is again re-injected into the body of the animal, and that is a T cell therapy. This is currently the ongoing research interest both in human as well as in animals, and this adoptive T cell therapy is available in case of canine immunotherapy domain. The next one, we have our immunomodulators, we have checkpoint inhibitors, we have cytokines, we have adjuvants. Here the important ones I would like to point out is the checkpoint inhibitors, which is currently in great demand, or you can say which is already in use in human medicine, but we are just at the development stage in case of canine immunotherapy. Here, checkpoint inhibitors, they are important because when immune response takes place in the body because of infectious pathogens or even allergens, so there is a system of, we call it as a cascade system, which will activate our immune system. Now, this activation of immune system or inhibition of immune system, this is checked by our immunomodulators like our checkpoint inhibitors. They can stop the response of immune system, or they can activate the immune response in the body. So this particular method is used, and these are currently in development for treatment of lymphoma. We have melanoma, high-grade glioma, that is brain tumor, as well as osteosarcoma. So we have NTPD1, NTBH73. These are the checkpoint molecules. They are currently under clinical trials. Hopefully they will be commercially available soon. Now we have the most common one, monoclonal antibodies. Monoclonal antibodies, we have a list of monoclonal antibodies which are already commercialized and already in use in case of canine medicine. We can use it for allergy therapy, then we can use it for infectious disease therapy, or we can also use it for autoimmune therapy. Now we have monoclonal antibodies, or we call them as naked monoclonal antibodies. These, they bind to the cell of our interest, be it infectious pathogens, they can be cancer cells, or they can be allergens. And then they can disrupt the immune response pathway, which is important for their activation. And it will prevent the growth of the growth of our pathogens or activation of allergens. So this is monoclonal antibodies. Then we also have antibody and a drug conjugate. That is, we have a specific target for a specific cell of our interest in the body, and we conjugate it, we bind it to antibody, and antibody has a specific target. It goes and binds to the specific target in the body. And we also have a bispecific antibody. Bispecific antibody, we take two antibodies, and antibodies at the variable region, we have the antigen binding site. So one antibody will be specific for antigen of our choice, that is, it can be allergen, it can be infectious pathogen, it can be virus, bacteria, or even a cancer molecule, and the other antigen, the variable portion which we have cut, that will bind to a T cell. T cell is part of our immune cell. So we joined the two cut portion of the variable portion of our antibody, one specific for example, cancer cells, another specific for the T cell in the body. So we have a bispecific antibody, or we call it as BiTEs. So the effectivity is 100 times more than naked monoclonal antibodies. So these are currently under research, ongoing research. Then we have small molecule inhibitors. The small molecule inhibitors are very tiny molecules. They can, because of their size, they can easily penetrate the cells, and then they go and then they disrupt the cascade system, which will activate many important proteins responsible for immune response. So small molecule inhibitors which are currently common in use and commercially produced is we have Apoquel, which is used for treatment of allergy in canines. We have Palladia, then we have Laverdia. Now cancer vaccines are also there. Currently there is one cancer vaccine which is EGFR and HER2. This is a cancer vaccine, that is epithelial growth factor receptor. This cancer vaccine is currently in clinical trial. Hopefully by next year it should be, let us hope it will be commercialized soon. Now oncolytic virotherapy is there are certain viruses which we use for targeting our specific cells, for example cancer cells, and then they will increase the immune response, and then in the process they will remove whatever is not wanted by the body, the cancer cells, the infectious pathogens like your bacteria, your fungi, your viruses. So these are the types of immunotherapy which are currently in active ongoing researches. Some of them are already commercialized. We already have a lot of approved and licensed immunotherapy, which you will see here in the table. We have allergens, then we have our infectious immunotherapy, then we have our Apoquel. These are your currently available immunotherapy trials, and we have Allermune, and then we have our Cytopoint, we have Cyclovens, and many more, as you can see in the slide. So this is about immunotherapy, the current development in case of canine immunotherapy. Now the future goals of immunotherapy is we wanted to induce the immunotherapy graph, that is raising the tail of immunotherapy graph, that is we want to induce more of our immune response so that we have a more effective immunotherapy. And then as we mentioned in the first few slides, combination therapy, that is a combination of all this immunotherapy that we have mentioned in combination with surgery, in combination with chemotherapy. They give you the maximum effect, and that is that can induce increased immunotherapy. Now there is another cancer which is hemangiosarcoma. This is a very difficult cancer which is very difficult to treat. So the focus on hemangiosarcoma will be the future goals, whereas where we can have a more effective immunotherapy apart from the normal surgery and the chemotherapy which is currently in use. Thank you.